Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Skeletal services in some hospitals in states across the country as resident doctors in Nigeria down tools indefinitely today. Nigeria receives 4 million doses of Moderna COVID-19 vaccine from the United States. And concerns grow as Delta outbreak spreads in China. As the world continues to witness a rise in COVID-19 cases, Nigeria is also witnessing its fair share as almost 1,500 cases were recorded over the weekend. According to the Nigeria Center for Disease Control, everyone must continue to adhere to all preventive guidelines to stay protected from getting infected with the virus. Let's take a look at the report.
A look at the gradually but fast increasing number of COVID cases nationwide is proof that Nigerians must not let down their guard. The NCDC, through its Take Responsibility campaign, is reminding Nigerians to adhere to all non-pharmaceutical interventions to curb the spread of the disease. Last week, there was a consistent surge in infections. However, the daily count of infections declined slightly in the last 24 hours, as the NCDC announced 407 confirmed cases from 16 states and the FCT in the last 24 hours. A look at NCDC's update shows that Lagos is on top of the chart with 160 cases, 75 in Akwa Ibom, 51 in Ondo, Abia had 33, Oyo had 29, while 18 were registered in Kaduna. Katsina had 7, Gombe and Ogun had 6 cases each, Ekiti had 5, while 4 cases were registered in Delta and the FCT. Other states include Ebonyi with 3, Edo and Niger registered 2, while Bayelsa and Nasarawa recorded 1 each. According to the agency, there were 0 cases reported from Kano, Osun, Plateau, Rivers and Sokoto. Nigeria now has a total of 174,315 confirmed cases. 11 persons have been discharged in the last 24 hours, raising the total number of recoveries to 165,005. There were no deaths from COVID complications in the last 24 hours, leaving the fatality toll at 2,149. With the recent increase in daily cases, active cases in Nigeria have now jumped to 7,151, while over 2.5 million samples have been tested so far. 17 people associated with the Tokyo Olympics 2020 Games have tested positive for COVID-19, making a total of 276 confirmed cases as compiled by the Games Committee. Over 6.7 million confirmed cases and more than 170,000 deaths have been recorded across countries in Africa. Globally, more than 198 million COVID-19 cases have been confirmed, while deaths have surpassed 4.2 million.
And resident doctors in Nigeria did make good their decision to down tools beginning today, following a directive by the national body to members across the country after an executive meeting of the National Executive Council of the Union. The resident doctors say they are taking this action following the federal government's failure to honour its side of a memorandum of understanding on salaries and other welfare issues signed almost 4 months ago. Well, let's begin in southwest Oyo State, where resident doctors at the University College Hospital, UCH Ibadan, joined their counterparts across the country. The Chairman Association of Resident Doctors at the Ibadan branch told Channels Television that the federal government has remained insensitive to the plight of doctors in Nigeria.
This is 113 days after our last national strike, and these demands have still not been met. And for example, in UCH now, we currently have about 215 doctors who are still on the GVMIS platform. They have not been paid their May, June, July salaries. And earlier on, they were initially owed January, February, March, April, May. That was paid about 2 months ago. And as we speak now, they are still being owed 3 months' salary.
In the southeast, in Umuahia, the Abia state capital, the strike action by now seems to have gained momentum, with a number of outpatients waiting to see medical doctors, but the consulting rooms were empty due to the strike action. Members of the Nigerian Association of Resident Doctors this time around at the Federal Medical Center, Imo State, Owerri, fully complied with the directives of its national body to down tools. Our Imo State correspondent who monitored the strike action at FMC Owerri reports that most of the outpatients were being attended to by only consultant doctors. And according to some of the patients, this development has no doubt slowed down the pace of response to healthcare delivery in this state.
As you can see, it's a nationwide strike, which FMC Owerri resident doctors are part of the strike. But as it stands, we've put everything in place to make sure that our patients don't suffer. Our consultants are working because we have quality and able consultants. We have other doctors like medical officers. Medical officers are also working, coupled with our consultants that are working.
In Edo State, resident doctors in UBTH insist the strike is mostly doctors' welfare related. The president of the UBTH branch decries a non-payment of salaries to resident doctors for months, as well as other challenges.
We called off the strike when we got promises. Our deadlines were maybe 1 week, 5 days, 1 month. The longest deadline was a month, in which all our initial demands would have been resolved. However, we've had series of meetings upon up to last week. And then to add insult upon injury, we've gotten that some of our members have been removed from the scale of service. So we are actually fighting because we have become an endangered species. And we have a lot of anti-doctor policies coming up every day, and we are tired.
In Kogi State, the management says the strike action will not have any effect as consultants are on ground to provide skeletal services. The head of corporate affairs at the University of Ilorin Teaching Hospital, Mrs. Olabisi Ajiboye, assures of access to healthcare services.
The national strike, not a local strike. And we know it's going to affect the clinical services of the hospital in a great way. Why? Because the resident doctors form the bulk of doctors that are taking care of the patients. But all the same, we have consultants on ground that will do skeletal services. They will attend to inpatients and outpatients, and even the patient that are in their care.
And the federal government has taken delivery of 4,080,000 doses of Moderna COVID-19 vaccine from the U.S. government. The U.S. government officially handed over 4,080,000 doses of the vaccine to the Presidential Steering Committee. Distribution only commenced after it has been certified for use by NAFDAC, and that is to come in the next 48 hours. Meanwhile, the World Health Organization says the vaccine is potent against variants of concern, including the Delta variant. And we go over to Kogi State, where measures to curtail the third wave of COVID-19, well, it appears that things are taking quite a turn there because the state appears to have many of the residents who have continued to live in denial. This next report takes a look at the situation. It's the state that's recorded as low as just 4 cases of the virus.
Looking closely at these videos, they look like visuals taken pre-COVID era. But make no mistakes anyways, as these are current pictures coming from Kogi State. Everyone seemed to be carrying on with business as usual, marketplaces, on the streets, at school playgrounds. There isn't any recognizable form of the very much advocated safety protocols in prevention and spread of the novel coronavirus. But why do they hold on to a different belief system?
I'm 100% in support of His Excellency, my governor. We don't believe in it. We only obey the face masks as a matter of policy. We don't believe in it.
Also, when other states of the Federation were on various forms of lockdown and curfew, Kogi State never had one.
Yeah, I heard about it, but I have no witnessed it anywhere, most especially in Kogi State here. But we heard about it, many people talk about it, but I have no witnessed it. That is why I don't believe on it.
A quick look at the NCDC chart puts Kogi's number very low. What is also ironic is that whilst the belief system is low, the state says it has recorded a large vaccination number.
We were able to vaccinate 889 doses so far for the first dose and the second dose alike.
Finally, we found someone who dared to be different, though he has some contemplations.
They told us where to take the vaccine, but my fear is a lot of video clips are on the net. They show us some people in Asia, some in Malaysia that took the thing, and when you put anything iron, it will be showing, or you put a bulb that is not having cable, put it on that spot where they kept it, before you know, it will on the bulb. So I wouldn't know, that has been my fear.
Isn't this a leadership body language?
Governor Yahaya Bello never said that, never denied the existence of COVID-19. This has to be taken, and that impression needs to be corrected. He also never stopped anyone from taking the vaccine. That impression also needs to be corrected. All I know, he has problem with the commercialization of the COVID-19.
Let's check the archives.
We should not be deceived again. Enough is enough. We should tell them that they should keep their COVID-19 to themselves. We don't need that market in Nigeria.
We tried reaching out to front health workers in the state, but none would want to comment on the paradox. The signs, sounds, figures, global reset, everything around the world today is indicative of shift in lifestyle occasioned by COVID-19. If those are anything to go by, it does appear like some danger may be lurking around the corner, and that could raise the appetite of national disease control officials to look again.
And the latest news just in has it that the Presidential Steering Committee on COVID-19 has promised to publish over 500 travelers who have violated the travel protocol and those who evaded quarantine. Travel passports that have been barred in the last 6 months will be lifted in the coming days, while those who evaded quarantine will similarly have restrictions on their international passports for 1 year. The Minister of Health, Dr. Osage Hanire, is also emphasizing that intrastate travel between Lagos, Akwa Ibom, Oyo Rivers, Kano, Plateau and the FCT is discouraged by the steering committee, except absolutely necessary because of the surge of the virus in those states. Well, joining us from Abuja studios, Dr. Abubakar Jafia is the Assistant Director Surveillance Epidemiology with the NCDC. Thank you for joining us on the program. We're seeing an update from the Presidential Steering Committee on travel, but we're also seeing a frequent rise in cases over the weekend. How are we assured of the reinforcement of the surveillance system at the country's points of entry?
Thank you very much, Millicent, and thank you for having me. The Presidential Task Force has a team that regularly monitors what happens around the globe, and they provide, guidance to the PSC and the country at large. Recently, the PSC has also reinstituted the COVID-19 health protection regulations, and this includes, the restriction of gatherings in workplaces, in non-workplaces to just about, 50 people, also ensuring that they adhere to the non-pharmaceutical interventions. Also, there's enforcement of travel regulations on travelers into the country. They have to ensure that, they do the 7-day quarantine. And for some travelers that are coming to certain countries, that have, high number of cases and the variants of concern. Usually they have to go into the institutional quarantine. Also, the protocol discourages physical meetings in government places. They encourage virtual meetings. And before people go into premises, they have to get their temperature checked, and they have to use face mask. It's either the no face mask, no entry policy has been activated. So these are the things that the PSC has put in place to ensure that the cases are controlled.
All right, let's take a quick break, Dr. Jafia, as we come back to continue the national response on COVID-19. Please stay with us. We've been talking to Dr. Abubakar Jafia, Assistant Director, Surveillance and Epidemiology with the NCDC. Thank you for your patience. Just continuing on the national response. Now, one of the restrictions on mass gatherings you've mentioned outside workplace settings says the maximum number of 50 people in enclosed spaces. But in terms of, physical distancing measures and other non-pharmaceutical interventions in place and, enforcing that, if you are outdoors, do you still need to put on a face mask? And this is also if you perhaps have access to more than 2 meters distance to another person. Do you need to wear a mask? And for office spaces and, those that have air conditioning, what is the advice?
Okay, so the truth of the matter here is that globally, we know that the production of vaccines, does not meet up the demand. And also in Nigeria, we are all aware that we are yet to start, the development of any vaccines as at now. So realistically, what we have is just the non-pharmaceutical interventions. And the non-pharmaceutical interventions is a comprehensive package. It includes, the hand washing and hand sanitization. It includes the use of face mask. It includes physical distancing, and it also includes, limiting social gatherings to a maximum of number of 50 people. So I will advise Nigerians that you should not, you should adhere to all the package of the, non-pharmaceutical interventions. Whether you are outside or inside, once you are outside your household, the most important thing is to adhere to all the non-pharmaceutical interventions. That is the only thing that we have now that will help us to prevent the spread of COVID-19 in Nigeria. Because the vaccines are not available as at now, are not enough.
Indeed, and it would take us some time to reach herd immunity. We would like to appreciate your time on the program. Abubakar Jafia, Doctor, the Assistant Director, Surveillance Epidemiology with the NCDC. Many thanks. We hope you can join us again.
Much.
South Africa has received 2.8 million Pfizer vaccine doses from the U.S. as part of a donation that is set to boost the country's vaccination rollout campaign. The acting health minister received the donation from the chief of mission at the U.S. Embassy in the country.
I'm here on behalf of the Republic of South Africa government and its people, appreciating the donation from the American government, led by President Biden, together with the American people, for this gesture, which is a good gesture to South Africa, in donating almost around 5.6 billion doses of Pfizer vaccine as part of our rollout, supporting for the rollout plan. Remember, this was the commitment after the bilateral meeting between President Ramaphosa and President Biden during their side meeting during G7, and where President Ramaphosa spoke and appealed to developed world that please assist us as the continent because we can't be left behind as we vaccinate. So this is a good gesture, and I think we appreciate this. We've written a letter to the American government, but we want to say here, Ambassador, thank you very much for this gesture, and thank you for on behalf of the people of South Africa. As we wrap up our vaccine rollout, this donation comes handy for us. It's going to assist us in terms of ramping up our vaccine program. As you have seen, where we are looking at more and more increasing in terms of the numbers of people who are going to be vaccinated in the country. The mood in terms of the people wanting to get vaccinated, we're now vaccinating the groups in terms of 35 plus. The 1st of September, we will be vaccinating almost the entire population that needs to be vaccinated, will be eligible to vaccinate.
And to Europe, where Malta is set to be still at the second wave of the pandemic. On the 12th of May this year, the Minister for Health announced that 70% of the Maltese population had become fully vaccinated, making it the first nation in the world to achieve herd immunity against the virus. The Malta College of Obstetricians and Gynecologists on Sunday are strongly now advising pregnant women to take the COVID-19 vaccine in view of virus complications being seen in pregnant women. Well, joining us from Malta is Dr. Adediran Adelekan, is the general practitioner, Berke Kara. Thank you for joining us on the program.
Thank you for having me.
All right, Doctor, how is the fight to COVID-19 in Malta? Because we're also seeing that the Delta variant is a threat to many countries around the world. What are the measures being taken to prevent the spread of the virus?
Well, Malta is doing very well with the vaccination efforts. Right now, we have over 75% of the population fully vaccinated. So we are the first country in the Europe to achieve herd immunity. And in fact, we aim to vaccinate 85% of the population. So as it stands now, Malta has the highest vaccination rate in the world.
So how is that affecting perhaps hospital? Are people getting down with COVID-19? How has that really affected the response in terms of the containment measures? And tell us what the restrictions are, if any.
Yes, right now, the total death rate is over just 400. And we've been seeing just less than 100 cases a day. And it has been going down in the past few days. So in terms of the result of the vaccination, we are seeing a positive effect. Of course, now we have 64 cases of the Delta variant, which also poses a threat. But we are optimistic and we believe that things will get better. Right now, we are relaxing the COVID-19 measures, precautions. Right now you can be in the public without the need for a face mask, provided you're not more than about 3 people. People are now, going out, more frequently. And but I think due to the fact that the vaccination now is at a very high rate, it gives us the liberty to open up economically, and businesses are now up and running.
All right, that sounds like great news coming from Malta. We'd like to appreciate your time. Thank you so much, Dr. Adediran Adelekan, General Practitioner, Berke Kara, Malta. Thank you for joining us on the program.
It's a pleasure to have.
And a fresh COVID outbreak in China has spread to more locations, raising concerns over the country's vulnerability to the highly contagious Delta variant. More than 300 cases have been detected within a span of 10 days. Here's more on the global update.
The Chinese government has imposed fresh travel restrictions and is testing millions as a fresh COVID outbreak spreads to more locations, raising concerns in local media over the country's vulnerability to the highly contagious Delta variant. More than 300 cases have been detected within a span of 10 days. Cases first emerged in July in Nanjing airport amongst workers who'd cleaned a plane that arrived from Russia. In Hong Kong, city leader Carrie Lam says unvaccinated Hong Kong government employees as well as education and health workers will soon have to pay for regular COVID tests, announcing measures to persuade more people to get vaccinated.
There is simply no room for complacency, despite the fact that we have achieved 0 local confirmed cases for 56 days. Because Hong Kong is a very well-connected international city. So the world around us is facing this challenge of another major rebound, as you can see from the 7-day moving average that I have shown you. So with that in mind, if we start to relax or to open our borders without subjecting passengers arriving Hong Kong to any quarantine, that we are putting the whole community at risk.
Hong Kong has registered 56 days without any local coronavirus cases, and life has largely returned to normal in the global financial hub, except heavy travel restrictions remain in place, with hotel quarantine required for all arrivals. Vietnam has extended strict curbs on movement in its business hub, Ho Chi Minh City, and another 18 cities and provinces throughout its south for another 2 weeks to help combat its worst COVID outbreak. After successfully containing the virus for much of the pandemic, Vietnam is facing a rapid spread of infections that has led to movement restrictions in around 1/3 of the country. It has registered a total of 145,000 cases and 1,306 deaths, 85% of which were recorded over the past month. Army patrols have hit the streets of Sydney to help enforce coronavirus curbs as Australia struggles to stop the Delta variant from spreading. Along with delivering essential food items to households in self-isolation, some 300 Army personnel who will be unarmed and under police command will go door to door to ensure people who've tested positive are isolating at their homes.
They will be working right across Sydney. No one suburb will be targeted. There will be ADF personnel deployed alongside police right across the city. The personnel, the ADF, will also be working in supportive roles to ensure that meals are delivered, to ensure that the police are supported in areas where they can then redeploy their assets to ensure compliances across the city are maintained and met.
Sydney, Australia's largest city, is into its 6th week of a lockdown as it struggles with a spike in infections that added nearly 3,500 cases since the first one was detected in a limousine driver who transported overseas airline crew.
Let's all continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. You can find breaking news as well. It's at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.